Welcome to Dr. Balaga's podcast for the curious doc. Today is August 10, 2026. This video is on a JAMA review titled Hip Fractures, published recently on July 16, 2026. What is a hip fracture? It's a fracture of the proximal femur, classified as intracapsular or extracapsular. How common are hip fractures? They affect about 14.2 million people worldwide every year and are common in older adults. Who is at highest risk? Older adults, particularly women, people with osteoporosis, and those prone to falls. What usually causes a hip fracture? More than 95% occur after a fall. What are the major fracture types? Femoral neck, intertrochanteric, subtrochanteric, and rarely femoral head fractures. What are the typical symptoms? Hip pain, inability to bear weight, and an externally rotated leg. How are hip fractures diagnosed? Primarily with plain X-ray radiographs, CT or MRI if suspicion persists. What increases fracture risk? Low bone mineral density, prior fracture, smoking, falls, and muscle weakness. How is fracture risk assessed? Using DEXA scan and tools such as FRAX, F-R-A-X. When is surgery recommended? Most patients require prompt surgical repair, ideally within 48 hours. What surgical options exist? Open reduction and internal fixation or hip arthroplasty. Why is early surgery important? It is associated with lower mortality. Is thromboprophylaxis needed? Yes, unless contraindicated, to reduce venous thromboembolism. What is rehab's role? Early mobilization and physical therapy improve recovery. Can patients bear weight early? Most can within 1 to 2 days after surgery. How can hip fractures be prevented? Fall prevention plus osteoporosis treatment. Which osteoporosis drugs are used? Bisphosphonates, denosumab, teriparatide, abloparatide, and romosozumab. Are calcium and vitamin D important? Recommended only when intake is inadequate. Why review medications? Some drugs increase fall or fracture risk. What is the long-term goal? Restore mobility, independence, and prevent recurrent fractures. This is an infographic of this article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.